and more than 590,000 bottles of hand sanitizer, all to long-term care facilities. This is a subset of the total amount of PPE that the department has pushed out since the beginning of the pandemic. As of April 6, 2021, the department's healthcare-associated infection team has provided direct consultation with every facility that has had at least one case of COVID-19. Since the beginning of the pandemic, that's more than 2,775 facilities. Rapid response teams using the state's staffing contractor, General Health Resources, the Pennsylvania National Guard, and the Regional Response Healthcare Collaborative Program, or the RIC, and the Regional Congregate Care Assistance Team, or the RCAT, have assisted many of the Commonwealth's long-term care facilities. ECRI, the infection control contractor working with the state, has provided intensive support for facilities with complex outbreaks or with the need for comprehensive infection prevention and control guidance beyond what is typically observed. ECRI provided intensive consultation to 150 long-term care facilities between April 2020 and January 2021. They continue to work in collaboration with our Department of Health team. Our efforts to prevent infection and spread within these facilities has been extraordinary. In 2020, the department told facilities they needed to complete universal testing of residents. When this did not occur in an expedited timeframe, by order of the Secretary, universal testing was required at all nursing homes, assisted living residences, personal care homes, and intermediate care facilities. The Wolf administration increased resources through the RIC and the Pennsylvania National Guard to assist with this effort. Once the initial universal testing was completed, the department shared further guidance on when testing should occur to protect staff and residents. The Centers for Medicaid and Medicaid Services then shared guidance on testing based on community spread, and the department worked to ensure resources were available to help facilities throughout the testing process. The department has also been working with facilities to ensure that follow-up testing is available to continue efforts to protect residents and staff. In total, more than 65,000 tests have been paid for by the department so that facilities have necessary resources to conduct testing during outbreaks to ensure that we are stopping the spread of COVID-19. A large portion of that work has been led by a program that was originally called the Regional Response Health Collaborative Program, or the RIC, and is now called the Regional Congregate Care Assistance Team, or the RCAT. These programs, which have been co-led by the Departments of Human Services, Department of Health, PEMA, and the National Guard, have been vital in protecting those in congregate care facilities. In May 2020, the Pennsylvania General Assembly appropriated $175 million of CARES Act funding to initially create the RIC program. This unique and highly successful program leveraged the expertise of a number of Pennsylvania's healthcare systems. Regionally, these systems provided direct support to long-term care facilities that were vulnerable to the pandemic, providing assistance on preparation, prevention, response, and education. Health system staff arrived on site to help with medical education on how to properly put on and take off PPE. In addition, the Pennsylvania National Guard soldiers provided direct patient care and also additional essential duties during outbreaks to support staff. This assistance was invaluable. This program has been extremely effective at helping mitigate the spread of the virus among vulnerable populations and responding quickly and appropriately when outbreaks have occurred. Around the beginning of 2021, the program transitioned to the RCAT program. However, many of the tasks and duties remained the same. RCATS and RICS have been assigned close to 20,000 missions to support long-term care facilities with readiness, education, infection prevention, testing, consultations, contact tracing, and support with fit testing and the use of PPE. RCATS and RICS have conducted more than 600 rapid response missions to assist facilities with current or potential outbreaks, to stabilize operations and staffing while ensuring the continuity of care and safety among residents and their families. RCATS and RICS have 24/7 call centers that have answered more than 2,200 calls and provided technical assistance over the phone in some situations. Associated with the program, the Jewish Healthcare Foundation has provided educational support to more than 6,800 employees. As demonstrated, this bipartisan and multi-agency program has saved lives and protected our most vulnerable Pennsylvanians. The hope at the end of this long pandemic has always been the COVID-19 vaccine. And since vaccine was first available in Pennsylvania, we have prioritized long-term care facilities to ensure that their staff and residents get vaccinated. In fact, for the first 5 weeks that the Commonwealth received vaccine, we set aside 50% of our overall allocation to ensure that we could start the federal pharmacy partnership, while using the other 50% of the vaccine to vaccinate our heroic frontline healthcare workers. Per the federal government, a certain amount of vaccine had to be set aside to start the partnership, which is why Pennsylvania had to wait a few weeks. Through the federal pharmacy partnership, we know that more than 400,000 doses of vaccine have been given to individuals in skilled nursing facilities, assisted living residences, personal care homes, intermediate care facilities, and other types of facilities through this program. We are excited to announce that this program has been completed for all participating long-term care facilities. However, we know that not all facility types were covered through this program, and so the administration, led by the Department of Human Services, worked with Rite Aid to start and secure DHS licensed facilities that were not part of the federal pharmacy partnership could still quickly get vaccinated. We know this program is close to wrapping up too. We have been working through a strategy to continue to provide vaccines to long-term care facilities to ensure that new residents and staff get vaccinated quickly. We will be leveraging federal allocations through the federal pharmacy partnership, and most facilities will be working with their typical long-term care pharmacy to ensure they are getting the vaccine. For those facilities whose long-term care pharmacies are not participating in the federal pharmacy partnership, they can choose to select another one of the participating pharmacies. If that's not available to them, the department will work with them directly to ensure they get the vaccine that they need. Today on our website, we have published the strategy for the provision of vaccine to long-term care facilities on an ongoing basis. Long-term care facilities and pharmacies will find all the information they need there to participate. Eligible long-term care facilities will administer the vaccine at the facility or work with a contractor, such as the facility themselves, to perform those duties. For many Pennsylvanians, we know one of the most challenging parts of the pandemic has been not being able to see their loved ones in order to protect them and others from the virus. This has been particularly apparent in long-term care facilities. As the federal government provides updates and guidance for nursing homes, the department has worked to align with these, as well as following best practices. We know that visitation in nursing homes is so important, not just for the resident, but for their loved one too. We have worked from the beginning to ensure the steps taken by the department protect residents and staff, while also allowing visitation within infection prevention and control protocols. For those living in long-term care facilities and their loved ones, this has been an extraordinarily long year. It is important that their social needs are met. The vaccine has been instrumental in allowing this, such as allowing close contact during visitation for fully vaccinated residents. But we need to continue our efforts to prevent the spread of the virus to our most vulnerable population. In addition to these steps, the department is close to finalizing our nursing home regulations. These have been a significant project for the department, and I commend our staff who have continued to work towards their completion amidst the pandemic. This will be our latest step to protect those who are living in skilled nursing facilities, to protect employees, and make sure that nursing home owners and operators are ensuring the health and well-being of residents. We are pleased at the depth of this work, but our commitment to our older Pennsylvanians will continue to ensure they are protected not only from the virus, but in an ongoing manner. Thank you. I'm now available to answer any questions.
Thank you very much. Our first question is going to be from Jim Melwert at KYW News.
I'm good, thanks. No questions.
Okay, thanks, Jim. All right. Our next question is going to be from Daniel Hamburg at ABC 27.
So my question is in regards to the federal pharmacy partnership. So if that program ended, I believe, in February, what took so long to fill the gap from, I talked yesterday with the Pennsylvania Healthcare Association, basically saying there were a lot of people, a lot of new residents and new staff members coming in, and there is no, there's nothing in place to get them vaccinated. What's your response to that?
Sure. So vaccinating those in long-term care facilities has been the utmost priority for the administration and the Department of Health. In between when the federal pharmacy partnership ended and our announcement today, there are many facilities who continued to vaccinate their residents and staff. That occurred through organic partnerships that happened with a local provider who was part of our focused network and indeed was a successful strategy for many.
Thank you. Up next, we have Jamie Martinez from Spotlight PA.
Thanks. I'd actually like to follow up Daniel's question. And related to some of the data that was released today from the vaccine survey to these facilities, is the department doing anything to follow up with those facilities and make sure that if they haven't built these organic partnerships, that they do have someone in, coming in to vaccinate new residents? What does the oversight look like there?
Absolutely. So our staff has been engaged directly with the facilities on this survey, understanding where they're at and what their next steps are going to be for weeks. So right now we know that 79% of residents and about 53% of staff in our skilled nursing facilities have been vaccinated, according to the data that we posted on our website today. I want to note that that data is a snapshot in time, and it will be updated quarterly moving forward. So you can expect to see new data available at the end of June to indicate how many staff and residents in each facility have been vaccinated. With respect to the follow-up that we're going to be doing, our goal is to address any type of vaccine hesitancy and ensure that everyone is being vaccinated as quickly as possible. And so our department will continue to work directly with the staff and residents in those facilities to address any concerns that they may have and to help them get vaccinated quickly.
Up next, we have Erin McCarthy from the Philadelphia Inquirer.
Hi, that 53% number for staff, that seems very low. Have you been able to figure out at all why that number is only 53 or what the barriers are? Do you know how much of it is hesitancy and how much of it may be the clinic's not occurring during their shifts or people working at multiple facilities? Have you been able to find out why, only 53% of staff members are getting shots?
Absolutely. So Actually, Pennsylvania's number is a bit higher than the national average that we've seen of staff in long-term care facilities be vaccinated. So while 53% seems a bit low, it is higher than the national average. With regard to why staff didn't want to get vaccinated, we did inquire as the department reached out. And so I don't have hard data for you, but anecdotally, what we've heard is that there were a number of staff who didn't want to be the first to get vaccinated. They wanted to see their colleagues, their families get vaccinated, and then they were willing to get vaccinated. That's why the program that the Pennsylvania Department of Health has set up to ensure that vaccinations continue in long-term care facilities is so important, because there are not just new staff and residents, but folks who, were just a bit more cautious or the like. And so we are going to continue vaccinating those people at their place of work during their normal business hours, as we did with these vaccine clinics through the Federal Pharmacy Partnership, to make it as easy as possible for our long-term care facility staff to be vaccinated.
Thank you. And next we have Sean Hamill from the Pittsburgh Post-Gazette. We're going to try one more time to see if Sean is able to unmute.
Oh, I'm sorry. There I go. There I go.
Yep.
Sorry about that. I just wanted to check just first a yes or no answer, and then I want to ask a question based on that. There was a reference to data online, and then you made some reference to facility data. Are you saying that you have posted or are going to post facility by facility data on vaccine percentages for staff and residents? And I'd like to ask a real quick follow-up based on your answer.
Yes.
It is posted now?
Yes.
Okay. And a point in time, so are you dating the point in time to when the survey was initiated? That's going more than a month ago now. And you said you're doing this quarterly. So you hope for that number to increase, I'm guessing, because and then kind of related to that figure is much lower than the number that I was given a month ago by the CDC, who said that it was north of 90% for residents in their nursing home data from the Federal Pharmacy Partnership, and 65% for staff. And I wonder if you could explain the difference. Thank you.
Several questions to unpack, Sean. Thank you. So with regard to it being a point in time, it's going to be dated the date that the survey was due, I believe. That was 2 weeks ago, maybe 3 weeks ago at this point. And so it will be a point in time. The survey data will be updated monthly. We required facilities by order of the secretary to respond to that survey, as well as any ongoing surveys that we would conduct relevant to the number of individuals vaccinated in these facilities. And so the next quarterly update will be at the end of June, and you can expect to see the data then. Yes, of course, we absolutely hope that that data is higher at the time, and that we're seeing an increased number of staff and residents be vaccinated. As I mentioned, we are doing everything we can to provide education, address questions, concerns, and the like for the staff in particular and residents of long-term care facilities so that they get vaccinated. I am not familiar with the data specifically, Sean, that you're citing, but I'd be delighted to have our press team follow up with you.
Thank you. Next, we have Stacy Burling from the Philadelphia Inquirer.
Hello. I also have a couple questions. I just am not sure I understand what this new long-term program looks like. Are you setting aside vaccine for them in a way that you haven't before? Is it going to be on-site vaccination? I'm just wondering how it's different from what they have access to now. And my second question, the group that has the lowest rate of vaccination is people who do home care among staff. Are you doing anything to address that healthcare worker group?
Sure, absolutely. So the strategy to vaccinate those in long-term care facilities that we're announcing today is unique because right now, as was noted, the federal government has not continued the federal pharmacy partnership in the same way it did previously. However, the federal government is allocating vaccine to specific partners who do have an opportunity to partner with long-term care pharmacies to vaccinate those facilities. So there are 3 long-term care federal partners. Those include GeriMed, Innovatics, and Managed Healthcare Associates. Those are called group purchasing organizations. They, along with CVS Omnicare, are going to be receiving vaccine directly from the federal government. Those are the entities that our long-term care pharmacies can request vaccine from in order to vaccinate the facilities. Now, many of those pharmacies are the local pharmacy partner that the facility already works with. And so for most facilities, they'll be able to simply go to their pharmacy partner, say that they need 50 residents, 25 staff, what have you, who need to be vaccinated. And then the pharmacy would work with the facility to set up an operational model to actually vaccinate those individuals. What the department has done is we have prioritized that those pharmacies are going to be enrolled through the Federal Pharmacy Partnership. We've been working directly with the CDC to ensure that that is an expedited path. And then we've also created an expedited path for pharmacies through the long-term care pharmacy program who are not currently enrolled in PACIS, which is our immunization registry, to have an expedited path to do so. We've also, as you can tell, this is a rather complex process. So we've created checklists for both the facilities and the pharmacy partners about each step that they need to take and every requirement that they need to do in order to make it as easy as possible for them to get enrolled and start vaccinating people quickly.
Up next, we have Scott Beveridge from the Observer Reporter.
Hi, good afternoon. My question was going to be what was the percentage of the residents or the workers have not been vaccinated, have refused to be vaccinated, but I did not catch what you said about the percentage of residents.
Sure, it's 79% of residents. And I will note that these are self-reported numbers. So these are numbers that the facilities told us through the survey that we sent out. And so there could be slight differences from what other data sources provide, but that's where we obtain this data.
Well, Dr. Levine had said earlier that these residents of these homes were getting sick because the employees were taking the virus into them. And I mean, are these folks still at risk if nearly half of these workers aren't getting vaccinated?
So what we know is that the way the virus spreads into facilities is that there's a high level of community transmission happening. The workers who are, our heroic frontline staff are just out doing normal things in their life, like going to the grocery store, picking their kids up, and the like, and they may asymptomatically contract the virus and bring it into the facility. To the extent that there are workers who haven't been vaccinated, this is why we strongly are encouraging them to be vaccinated and for the residents to become vaccinated themselves. But until we are able and have access to an adequate supply of vaccine from the federal government, we are encouraging everybody to do their part in keeping the community transmission low. We are seeing rising case counts across the Commonwealth, and it is still on all of us to do our part by wearing a mask when we're in public, social distancing, washing our hands, and staying home when we're sick. Because it is that community spread that leads to outbreaks in the facilities, and until we've had enough time to vaccinate everyone and we see those levels of community transmission go down, we all need to continue to do our part to keep our most vulnerable Pennsylvanians safe.
Thank you. Next, we have Hayden Mittman from PBS 39.
Hi, thank you. I just have a quick question about could what we're announcing today have any impact on visitation and reopening of assisted living and elderly care centers? I know anecdotally I've heard from local retirement homes that they hoping to open as early as next month, the beginning of next month. could this have any impact on requirements or restrictions?
Sure. So I can only speak for the skilled nursing facilities, but at least the skilled nursing facilities, which the Department of Health regulates, actually are required to have visitation per the Centers for Medicare and Medicaid Services. To the extent that there are 70% or more residents who are vaccinated, they're allowing for close contact at this time. But and so to the extent that there are individuals in those facilities who have not yet been vaccinated, this program will allow them to do that. And I will add that this vaccination program is not limited to skilled nursing facilities. It's available to assisted living, personal care, intermediate care facilities, and the like. And so to the extent that that vaccination is required in other facilities to allow visitation, it absolutely will be helpful to them.
Next, we have David Bruce from Erie Times News.
Okay, can you hear me now? Yes. Okay. What is do you have a percentage of the number of long-term care facilities that weren't able to continue vaccinating their staff and residents over the last couple of months since the end of the partnership?
I do not have that data at my fingertips, but our press team can follow up with you.
Do you have any idea if it was a majority, or if we're talking about I mean, I know you don't have a direct one in front of you, but do you have an idea if it was a majority of the facilities?
Again, I'd rather give you the data that we have, so our press team will follow up.
All right, thank you.
All right, and our last question from today is going to be from Jason Laughlin from the Philadelphia Inquirer.
Sorry, no questions here. Thanks.
All right, well, that concludes our press conference today. Thank you, and a PA cast will be available later.